This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
So I'll do a quick medical minute on how to properly apply painful stimuli to assess a patient's level of consciousness. So it's something that is actually super important when you have a patient they're altered, and we need to kind of assess very quickly, are they alert, are they lethargic, obtunded, or comatose, right? ALOC, that's kind of our acronym for that. And so the decision is, are they obtunded or comatose based on, do they respond to painful stimuli or not? And there's lots of different ways people have done this, but there's actually only 3 approved ways to actually do this. Does anyone know any of these ways that you actually can assess for central kind of brain activity? So how to apply a central stimulus to determine a patient's level of consciousness. Does anyone know any of these ways? Sternal rub, that's one way. That is one approved way. The trapezius pinch, that's another one, and there's one more. So no, a nail bed is peripheral. So that will test a spinal cord reflex. It will not test their level of consciousness. There you go. So the last one is the supraorbital rim. So that is another central stimulus. So I just say that because that is really important. And so if you're trying to do like a toenail, pinch, or a nipple pinch, or pinching the patient somewhere else, yeah, right. That is not actually assessing their level of consciousness. It's not a central stimulus. It is technically ineffective and unethical. So we should not be doing that. We should be doing trap pinches, sternal rubs, or supraorbital rim pressure to assess their level of consciousness. So either way, that's all.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.